So we had a mid-age beautiful lady, actually, as you can see, with the high BMI. So, and she was interested in getting liposuction as a body contouring. So, as you can see, she has some extra fat and extra skin, obviously, in different areas in her body. So, if you want to start from the torso, the body, upper body, so as you can see, she has like on her breast, you can see ptosis, which is actually droopy breast under this natural inframammary line. So it means you have extra skin, extra fat, or breast tissue, and it just we call it like megalomastia. So obviously, if you want to just contour the upper body, you need to do something about the breasts. So if you want to just reduce the volume, you should do mamoplasty. We call it reduction mamoplasty. At the same time, and you can see just a droopy breast, so we call it ptosis. We need to address that by surgery we call lift. So breast lift and reduction is something that she needs to just kind of contour her breast areas and the borderlines. So about the abdomen, as you can see again here, we have an extra volume of fat, and obviously in lower abdomen you have that saggy skin in lower part, like infra umbilical area. So it shows us that we have extra fat and extra volume, extra skin. So we need to address both of them. So I'm gonna just show more about the plan that we already talked about. So for breast, for example, so when you have the nipple areola here, and you have this line here, as you can see, we have the imaginary line here. We call it IMF, means inframammary fold or line. So if your nipple areolar complex is below this line, it means you have a grade of lactosis, breast drooping. So normally you have your complex above this line, and that's a kind of a principle in aesthetic measure. So if you have this complex below this line, means you need a procedure, we call it lift. If you have like more volume than a normal, body type, means you have some signs and symptoms of heavy breast, means like your neck, shoulder, back pain. So and some kind of dermatitis below this volume of breast. So it means you have megalomastia. So macromastia, it means your volume is just too much for your body, BMI and your body style. So it means you need to reduce that. So we call it, as we had here, breast lift, and then for reducing the volume, we call it breast reduction. So both are under category of mammoplasty. So here, for this specific patient, for her breast, she needs reduction and lift as a mammoplasty procedure that we're gonna do down the road, probably in 6 months. For the abdomen part, which was her most concern, as I talked about the having two components, like means skin and evaluating the volume of fat volume. So you just see if the skin is just tight enough for that body style, or the fat is just kind of normal for that body style. So for her, the most accurate kind of indicator of fat volume is something we call it BMI. So in BMI, so you can just calculate your BMI by dividing your weight in kilogram to square of height in meter, all right? So meter. So, and the BMI helps us to decide how many areas we can, address in one session. So why is that maximum and like those limitations in our liposuction part? The reason is because the nature of liposuction is you're just reducing the fat volume. Fat doesn't come out by itself. You need to break it down and then at the same time do something about the vessels, blood vessels. Obviously, when you're just like breaking down those fibers to just loosen the fat, you're gonna have some vessels that's just gonna definitely be injured. And that's the problem, because the more you get the fat out, the more bleeding you're gonna have. So that's the reason in liposuction principles, we add something to a fluid that we add to fat before liposuction that is obviously a vasoconstrictor, means like shrinks the blood vessels to stop bleeding. So the stages that we have in liposuction is the fat is just a kind of solid tissue. So it has some fibrotic bands between the tissues. So you need to break it down and then suction out with that the negative pressure force to suck it out and then get rid of that fat. So to break down those fibers without any pain. So you definitely need something to relieve the pain. So part of that fluid that we inject before liposuction inside the fat is something we call lidocaine. So it's a kind of anesthetic. So it gives you a kind of more comfortable experience during liposuction. So we inject the fluid. We call that fluid tumescent fluid. Tumescent fluid. So it includes a prepared bag of fluids. We call it LR, lactated ringer. We add lidocaine, which is anesthetic, and then, as I talked before, so you can't suck out the fat without injuring any blood vessels. To minimize that blood vessels injury and blood loss, minimize the blood loss, you need to have the maximum vasoconstrictor during liposuction. So we achieve that goal with something we call it epinephrine. So as you can see, we have three main components of tumescent fluid we inject before liposuction. So the third part, which is important, is your state regulation. So every state has its own regulations about any procedures. Specifically for liposuction, since patient safety is the most important thing in our career, and after liposuction, you're going to lose a lot of fluids. So the more you do liposuction, the more you're going to lose the fluids, and these fluids kind of makes your blood flow kind of thick. So it's very important to have a limit on the volume of fat you can get in one session, because you're helping the body to kind of balance the whole fluid, electrolytes, everything that you're losing after surgery. So that's why for patient safety, every state has its own regulations. In New York State, we have a maximum limit for the total aspiration we can do, like the total volume we can take out in one session, and it's 5 liters. So, and that's very important to know that when we do liposuction, we call this regulation, this maximum limit, total aspirate. So total aspirate of 5 liters maximum in New York City, in New York State. So, And it's important to know the terminology of the liposuction here more. So when we call total aspirate, what does it mean? So when we do liposuction and we have a canister here, this is the suction tube and this is the liposuction, the fat suctioning and just, draining here. So at the end of the day, when you just finish one canister, you're gonna have a canister full of fluid, fat. Since the fat is just lighter than the water or fluids, the fluids goes down. So you have a kind of pinkish fluid here. Fluid. And the fat on top. So the terminology for liposuction calls this supernatant, and this one infranatant. So when we talk about total aspirate in any states, for example, in Florida state, it's 4 liters of pure fat, but New York state is total aspirate, so it's different. So it means in New York, you're allowed to take out the whole fluid plus fat should be less than 5 liters. So fat plus the fluid, we call it total aspirate. Total aspirate. So we remove this fluid, and the only thing that we can use in our fat graft is this pure fat on top. When Florida State talks about the limits, they're talking about 4 liters of pure fat. So it means no matter how much you get as a aspiration fluid itself, the pure fat matters for them. So it means you can't go beyond 4 liters of fat. It means if you have even like 7 liters of total aspirate, as long as your fat is below 4 liters, it's okay. But in New York State, the limitation is a little bit tighter. So it means the total aspirate should be less than 5 liters. And I think that makes sense kind of more in terms of patient safety, because it's true that this fluid is garbage, we're going to throw it away, but the problem is this fluid has the most important electrolytes, like those kind of fluid important kind of elements that your body needs, and then when you lose it, you're gonna have more imbalance in your systemic metabolism, all these functional that you get from your systems. So it means the more limit you put on the total aspirate, I think it's safer for the patients at the end. So we have 3 different parameters here, and the plastic surgeon's art is to play within this limits. So for example, for this beautiful patient that we did this morning, we had a BMI about 34, and she had extra fat and extra skin in her abdomen and back. And also we wanted to do it under not general anesthesia, we call it IV sedation plus local anesthesia. We use this part, the liposuction tumescent kind of combination, and then BMI, which was 34, and we should go below 5 liters in one session. So what this BMI tells us is that if you have a BMI more than 30, so it shows that you have at least below 30, at least you have 5 liters around your torso. What does it mean? It means if you have low BMI, means lower than 29 or 30, your extra fat volume is 5 liters. And it means that you can do the procedure in one session, since the New York State allows you to do 5 liters in one session. So it means around torso you have 5 liters, and it means you can address the whole extra fat around torso, means full abdomen and the back, flanks in one session today. So what happens if the BMI is higher than that? So if you have BMI more than 30, which is I assume our patients in that category, BMI 34, it means around your torso you have at least 8 to 10 liters of extra fat that you should address with liposuction. So it means you can't go beyond 5 liters in one session. So you can't get rid of the whole fat around the patient's body in one session like today. So it means you should break it down in 2 sessions at least, because you have 10 liters of extra fat and you're allowed to take out one 5 liters canister in one session. So you should do it at least in 2 sessions. So that's the thing that happened for our patient. So high BMI, 5 liter limit, and we want to do it under IV sedation and local anesthesia. That was our combination of our tumescent fluid. And then we decided to do just the front, means the upper abdomen, lower abdomen, and bra line. So we call this full abdomen. For our patient, we decided to do full abdomen and make sure we're taking out the whole 5 liters today. And then down the road, after 2-3 weeks, that your body needs to kind of balance the whole fluids and electrolytes that losing, we can go for the second step, that is liposuction of the back. So this is the kind of roughly indicators and the parameters that help us to decide how plan the patient's kind of surgery. This is a journey, so as you can see, you should just take care of the time, take care of the procedures itself, and make sure that you're fully communicate with the patient, and then we can just address each expectation itself and kind of modify those expectations, because one of the plastic surgeon's job in the first meeting as a consultation is to balance the patient expectations, which is sometimes unrealistic, to something more realistic, and then balance those expectations with the reality. And also very important, the plastic surgeon's ability to deliver those results. And the only thing you see as a patient, you want the best, but it's not always realistic or kind of deliverable, even with the best hands or with the best devices and planning.